on the severity of your symptoms and the severity of the osteoarthritis, as well as your age, your level of activity. And these range from conservative measures all the way up to surgery. Now, conservative measures describe types of treatment that don't involve surgery or minimal intervention. And so this is always a good place to start. So reducing your weight, exercising the muscles, increasing the strength and tone of the muscles around the joint by getting physiotherapy, advice from dietitians, etc., is always a good place to start. These can be augmented with injections. Now, there are different types of injections that exist. There are three main categories: steroid injections, hyaluronic acid injections, and platelet-rich plasma injection. Steroid injections have been used for decades in the orthopedic community to help treat joint problems and swelling and pain. These have their place, especially when there's an inflammatory component to the joint problem. Unfortunately, research has shown that continued and repeated use of steroids increases the likelihood of requiring a joint replacement operation at a much earlier time point. And the reason for that is that steroids, they help with pain and swelling, but unfortunately, they accelerate the underlying imbalance in the enzymes within the cartilage and actually accelerate the matrix breakdown and result in earlier breakdown of the cartilage. So steroids have their place, but they are being used less and less often in joint pathology. The second category is hyaluronic acid, and this acts more as a nourishing injection into the joint. It doesn't have a biological component, and the working molecule is the hyaluronan molecule, which helps to nourish the cartilage. And the consistency of the HA also helps to cushion the joint and provide a lubricant, and people report benefits from hyaluronic acid. It doesn't, however, slow down or stop the arthritic process worsening. Third category of conservative management are PRP injections, and PRP stands for platelet-rich plasma, and there's a whole section on how this works, but briefly, the growth factors released by the platelets dampen down the activity of those enzymes and stop the cartilage breaking down, as well as having a positive effect on inflammation and pain, and they help to maintain the cartilage that you have inside them. The surgical treatment for osteoarthritis can be split up into two broad categories. There is joint preservation surgery and joint replacement surgery. Joint preservation surgery is a new philosophy in orthopedics and knee surgery where we aim to maintain your own knee for as long as possible. And this is most relevant in younger patients. And we're seeing more and more arthritis presenting at a younger age. And it is not advisable to have a knee replacement or any replacement operation carried out at a younger age in life. The reason for this being that joint replacements eventually wear out and become loose and require a revision operation where the prosthesis is removed from the knee and a bigger prosthesis is put back in. The average lifespan of a total knee replacement is around 10 to 15 years, but this lifespan is shorter when the implant is put into a younger patient who has higher demand and is more likely to use the knee more and more. Total knee replacement surgery works very well, and it works very well in patients who have a degenerate knee in all three compartments with a limited range of movement at an older age. At a younger age, people tend to present with arthritis in only one compartment, and this is where the joint preservation approach can be utilized.